Bismillahirrahmanirrahim. Assalamu alaikum. I am Professor Dr. Javed Iqbal FAROOQI, and you are watching my YouTube channel, Health Education. Today, we continue our updated series on fatty liver disease. In the previous videos, we discussed what fatty liver is, how it develops, and what symptoms you might notice. But in this video, we will go one step further and talk about the complications of fatty liver, because this condition may look simple in the beginning, but if ignored, it can silently damage your liver and even your life. Fatty liver disease starts with the simple accumulation of fat inside liver cells. If lifestyle and diet are not corrected, this fat starts irritating and inflaming the liver, a stage we called MASH. This inflammation damages liver cells and creates scar tissue. When the inflammation continues for years, that scar tissue becomes permanent and gradually replaces healthy liver cells. This stage is called liver fibrosis, which can progress to liver cirrhosis. Cirrhosis means that liver becomes hard, shrunken, and unable to perform its normal functions like detoxifications, metabolism, and protein production. In advanced cases, the liver loses its capacity to function. Patients develop serious problems such as fluid in the abdomen, which is called ascites, swelling in legs, which is called edema, bleeding from the stomach or food pipe, that is called variceal bleeding, confusion or drowsiness due to toxins, and this is called hepatic encephalopathy. At this stage, liver transplantation may be the only option left. Fatty liver disease also increases the risk of liver cancer, which is called hepatocellular carcinoma, even in people who have never consumed alcohol or have no viral hepatitis. That's why regular follow-ups and ultrasound screening are extremely important. Fatty liver disease does not just affect the liver. It is often part of a large condition called metabolic syndrome, which includes obesity, diabetes, high blood pressure, high cholesterol. All of these increase the risk of heart disease and stroke as well. So you see, fatty liver disease is not just about fat in the liver. It's a full-blown, full-body alarm, a signal that your metabolism, diet, and lifestyle needs urgent attention. In the next videos, we'll discuss how fatty liver is diagnosed, and most importantly, how it can be treated and reversed. Until then, take care of your health, eat mindfully, and get your liver tests done regularly. This is Dr. Javed Iqbal FAROOQI, and you are watching Health Education, because awareness saves lives. Allah Hafiz.